show me your wristband? Okay, and state your full name and your date of birth.
Maria Rodriguez, October 10, 82.
Okay, all right. Do you have any allergies, Ms. Rodriguez? Allergies?
Don't think so.
Okay. I think we're gonna need a translator. Give me just a minute.
Please. No English.
Hey, girl. Yeah. Anyways, all right. So I have someone who can't speak English. Can you send a translator like ASAP? An hour? An hour. I don't have time for that. Never mind. All right. Well, I can't get a translator, so we'll just do the best we can, okay? All right. I need you to sign this paper. All righty, let's get started. First thing we gotta do is start an IV. Okay. Pump your fist. Okay. Good job. Okay. I'm going to put some medicine into your arm, okay? I'm going to go real slow. Alrighty, we're going to give that a few minutes. Be back to check on you. Oh my gosh.
Hey, girl.
Oh my God, you would not believe the patient I have right now.
What's up?
This Mexican chick.
Is she in there right now?
Yes, look.
Oh my God, loving the hair.
I know. Actually, do really like it.
I know, so do I.
Well, anyways, she doesn't speak a lick of English. Like, no English.
Did you call for a translator?
I did. They said it was going to be an hour.
An hour? What are you supposed to do for an hour?
I know.
Just sit
I don't
there?
have time for that. You think the doctor's going to wait an hour for this?
A doctor?
Please.
You think my Candy Crush is going to wait that long? I don't think so.
Señorita.
Oh, did you see the little students that came in today?
Oh, they're not going to make it.
Aren't they so adorable?
They're heroes.
Do I have any whiskey? Oh, yeah, your patient.
Oh, I forgot she was in there.
Ooh, she doesn't look too good. Oh.
Is there a Regina Flanger here?
Oh, that's me.
You have been served.
What is that for?
Do you remember that patient we had a few weeks ago?
I'm not getting served.
Okay, all right. My patient, remember she couldn't speak English. I called for the translator.
Yeah.
One
Right.
She's saying that we did treatment without consent. She
signed
the form.
paper.
She signed it.
So then you're not legally liable for anything.
What am I going to do?
I'm sure you're fine.
Good afternoon. Court is now in session. Case 64895, Maria Rodriguez versus Regina Flanger is now in session. Would the defense please rise? Ms. Flanger, you have been charged with occupational negligence. How do you plead?
Not guilty, Your Honor.
Ms. Rodriguez, we will hear from you now. Please tell us what happened.
Bird gave me something, and I could not no breathe. I asked, I need Spanish, cause no English.
Ms. Rodriguez, did you sign an informed consent before this procedure?
I did. I don't know, cause no understand.
Did they have a translator there for you, ma'am?
No, and I told her no English, Spanish only, please.
Ms. Flanger, will you please tell us what happened? Ms. Rodriguez, you can have a seat.
Well, the patient came in and she could speak a little bit of English. Like, I could totally tell that she kind of understood what I was saying. I called for a translator. there wasn't a translator available. That's not my fault. We have a schedule to keep, so I had to keep going. And so we went along with it. She signed the paper. I watched her sign it. And then we started the procedure. I got my scalp films. Everything was fine. I started her IV, put in the contrast, and just like with any other patient, we had to wait a few minutes. And when we went back in is when she was having the allergic reaction. I didn't know that she would have an allergic reaction. I asked her, does she have allergies? And she said no.
Thank you, Ms. Flange. According to the federal law, though, informed consent given to the subject must be given in the language understandable to that patient or to that representative. But in this case, I have brought in an expert witness, Ms. Anita McKnight, the department chair of FTC's radiography program, and over 30 years of experience to speak on your behalf.
Ms. Phalange. I have been a teacher, and I have also been practicing in this field for 30 years. And you know, my first year teaching, I actually had a student that looked almost identical to you. She would right next to this adorable little bakery. Oh, it was my favorite quadruple layered cake. It was so amazing. I couldn't believe it. So to answer your question, though, this is a very important case regarding the patient ethics and standards. I actually printed off the list here for you if you'd like to look over those.
Yes, ma'am.
And I will go ahead and read a few if you'd like.
Okay,
Is that
sure.
okay? Oh,
Yes,
fantastic. Okay. Now, we have Ms. Phalange. You will probably remember these. The radiologic technologist assesses situations, exercises care, discretion, and judgment, assumes responsibility for professional decisions, and acts in the best interest of the patient. They also perform services in accordance with an accepted standard of practice and demonstrate expertise in minimizing radiation exposure to patient, self, and other members of the healthcare team.
I will take any closing remarks at this time now. Ms. Phalange.
Your Honor, I'm innocent. I did everything that I could do. There was no translator available. The patient acted like she understood what I was saying. She would shake her head yes and smile. I mean, she knew what was going on, and she signed the paper. That's all, Your Honor.
We'll hear from Ms. Rodriguez now.
No, because I went to doctor, to hospital, and now I don't have money. Who's gonna pay? And I was sick. I don't know. No.
Ms. Rodriguez, did you incur any financial costs from this injury?
Yes, I went to hospital. No breathe, I can't.
How many days did you stay in the hospital, ma'am?
2.
Thank you. You may be seated. Well, according with what we have heard today in the federal regulations, I, Judge Fairley, find Regina Phalange guilty of occupational negligence.
What am I gonna do? Okay, I'll admit, the video that we made may have been a little bit on the dramatic and funny, somewhat cheesy side. But don't let that fool you. The situation that we were portraying is not only real, but it will happen, and it is serious. UNC's demography website states that Spanish-speaking individuals has grown from 43,000 in 1980 to over 638,000 from 2009 to 2011. Spanish is not the only language that has increased over the years. Today, nearly 11% of North Carolinians speak another language other than English at home. That represents nearly 1 million people here in this state alone.
The 6th edition of Radiologic Sciences and Patient Care textbook states that a patient cannot be truly informed if he or she does not understand what is attempting to be communicated to them. Federal regulations enforced by the Office of Human Research Protections and the Food and Drug Administration state that informed consent shall be in a language understandable to the subject or the representative.
So what does this mean for you? Get informed, educate yourself on your facility's procedure for providing quality care for non-English speaking patients. Major facilities provide translators simply by making a quick call to the patient services. Language is the most important method of communication. Patients with limited English proficiency are at a higher risk for receiving inadequate patient care and informed consent. Remember, when speaking to non-English speaking patients, speak slowly, do not raise your voice, repeat information, avoid using medical terminology and long explanations, use pictures and models to illustrate words, and always make sure that you have been understood.
The ART provides an extensive code of ethics, with optimal patient care being #1 goal for every registered radiologic technologist. Failure to follow the ART code of ethics can result in reprimand through several stages of increasing severity up to and including revocation of legal action. As a rule, when there is a case for malpractice, everyone listed in the patient medical record is named in the suit.
A 9-year-old Vietnamese girl died because of a reaction to the drug Reglan. The family did not speak English and had no interpreter provided for them. Because of the lack of translated informed consent, the family was paid $200,000 for the loss of their daughter.
59-year-old female patient from Egypt did not speak English. Due to irreversible hemorrhagic shock and cardiorespiratory, the patient died. The family was awarded $85,000 because the informed consent was not adequately conveyed.
A 45-year-old Spanish-speaking male left the hospital after being discharged. After leaving, he began vomiting blood and required treatment. Because he was not given an interpreter to explain the informed consent, he had little understanding of how to proceed and what was happening.
A 73-year-old woman was hospitalized. Because the patient did not understand what was going on, the radiologist had a difficult time performing the exam. Medication did lessen her movements, but the radiographs were deemed non-diagnostic. As the radiologist was about to inject the contrast medium for the second time, the patient lost consciousness. The patient died 3 days later due to a vertebral vascular accident. Because the patient was not given an informed consent in the language that she understood, the family was awarded $320,000.
It's up to you to make the right call. Will you?
No one told you life was gonna be this way. Your job's a joke.